have 2 young people in recovery who sit with me on this panel. I am the face of addiction. One of the largest growing people impacted by opioid addiction right now are middle-aged moms and soccer moms. And so there is not anybody who's untouched by this epidemic. And anything that you can do, if you could know the ability you have to positively impact your clients by the way you treat them and by the hope that you give them, that is a profound thing. And I think that people underestimate how much everyone has a role to play in combating this epidemic. So you all are playing a role in it. So I'm grateful for that.
They continue to not necessarily watch my patients, but give us a heads up if they see something awry or good, for that matter. Having a partner like Cordant who can see my patients outside of the office, and they can even tell me, hey, listen, I know you in your notes you say he's using a walker, but when he came in here, he was twirling the cane. And this is a community plan. We're approaching their pain and their function in a multimodal approach. Cordant, Dr. Mims, their PCP, we're all together trying to get them to the same spot, and that is functional in society, and hopefully still working, and that not everybody on disability.
I'm one of your biggest advocates. I trust in the system. I trust in the lab. There's, we'll talk about some stories as we go further, but to where, I think it's just given us great documentation when we're really trying to address behavior, because that's what probation does, right? We've really changed over the system. We're not I used to call it the trail, nail, and jail game, right? We're waiting for you to do something wrong. And we're really trying to change that perception of defendants coming in here, that we're not about that anymore. Like, we're more case managers, social workers, if you think about it. We've been tasked by the bench, as a court order to monitor certain things, and we're utilizing all the tools in our wheelhouse to be successful at that. But it's also about that relationship. But I think it's about that accountability piece. And I think by having, a system that you trust in that, the validations and the confirmations, that, it's hard to dispute when you have it.
They were super compassionate and understanding, and there was no shame. There was no second guessing my validity and my truth and my honesty. It was just taken at face value for what it was, that there was a person who was using your services, who was successful, who was wanting to continue using your services, but was freaked out. And they got my bill down to, I think it was $50. And I almost cried. I was okay, I can do this. I can afford this. Not only is this drug test, it's holding me accountable. It's doing things that I don't know that I can do. It's checking the levels to make sure that I'm on the correct therapeutic doses for my medications. It's doing all of these huge things. And I can afford it, and I can continue to see the doctor that I can't play games with.
This has to be a relationship business. It was feeling before like it was us against them with the pharmacies locally, and none of them know us. They don't know me from Adam. I'd like to get to know some of them. I'd like to work as a team, but it felt like it was an us against them situation, and in that case, everybody loses. The patient doesn't get what they need. We go home feeling like we made a gazillion mistakes during the day. All day long, the phone was ringing from pharmacists, and not with legit questions, just things saying, I don't think you should prescribe this. Well, why not? Well, this doesn't warrant that diagnosis code. Really? The diagnosis code says degenerative disc disease. How about degenerative disc disease with 8 surgeries? And that's the kind of stuff that if Pete wants to know, he can get in touch with us immediately, and we can get in touch with him and say, we're doing this because we feel this is safe and so we have a relationship.
Toxicology testing is not just a weapon, it's a tool to help people. I'm overweight. If I have to go to Weight Watchers and I know I have to stand on a scale that itself is a motivating factor. So both as a motivating factor for the patient, in other words, well, Dr. Kunkel's going to catch me if I do something bad, and to protect the physician so he or she doesn't become a target for people that are going to do the most common thing, urine substitution. So it becomes both a tool and a weapon.